The statewide mask mandate in schools will be lifted, and it will now be up to each individual district to decide whether or not to require them in classrooms. As these restrictions ease, what should parents know about COVID-19 safety for their kids? And joining us now is Dr. Juan Salazar, physician-in-chief at Connecticut Children. Dr. Salazar, thank you as always for being with us.
Erin, good to see you. Glad to be here with you.
So obviously, February 28th, a very big day when that state mandate ends. So it is almost the start of a new season and a new breakthrough in terms of the COVID-19 pandemic. For parents who are kind of unsure where to go from here, do you think it's safe for them to start doing activities that maybe some have been putting off, like indoor play dates or indoor sports? What would you recommend?
Yeah, thanks, Erin. It's a great question. And so, as I've always said, each family has to make their own individual decision based on their risk factors. It depends where you live, with how many people you live, whether you're have somebody in the household who's immunocompromised, whether the kids are vaccinated. So there are many, many factors. In general, just basic recommendations. The kids are vaccinated. You're going to be outdoors. You're going to be in a non-crowded situation. I think we're getting to a place where it is safe. Ideally, past March 15th, certainly by April 1st, it's going to be really good. I'm very pleased to see where the numbers are going. Connecticut, I think today was less than 3% positivity rate. So we are going in the right direction, and I want to give a lot of optimism to parents. But just be careful. If you're going to a large party, if you're going to a place where you don't know the kids are vaccinated or the adults are vaccinated, or if you have a household member who's immunocompromised, who may be at risk, then you have to wait a little bit more than just March 1st. You switch the lights on and everything changes. So just still be careful. Be cognizant that we're not out of the woods yet, but are almost there.
What about for school? Obviously, some districts have already come out stating that they will keep the mask mandate in effect for at least the next few weeks, maybe the next month or so. For those districts who have decided to go optional, this can put parents in a precarious position of trying to decide whether to send their child to school with or without a mask. Do you have any advice for them on what they should do in those kinds of situations?
Yeah, thanks. So there are certain school districts, I spoke to Dr. Leslie Torres Rodriguez, who's the superintendent here in Hartford in the school systems. And in Hartford, the vaccination rates are pretty low, unfortunately. They're less than 20% in that age group 5 to 11, and only 49% in the kids above 11. So, right now, because COVID's still, the transmission is still high, it's recommended that in the school district in Hartford, they remain masked until the end of March. By April 1st, it's going to be a little bit better. There are other towns where perhaps the vaccination rates are higher. They have a better ability to make sure keep the kids distanced in some way. And perhaps in those situations, the towns have decided not to wear a mask or not to recommend a mask. I still tell people that each family, each one of you, has the ability to make a decision. And I would recommend, if there's a particular risk factor for that child or that family, that at least through the month of March, you tell your kids to wear the mask. And I know there'll be peer pressures, social pressures, but wearing it, they've done it for so long now, the kids actually don't have real trouble with the mask. I think it's more the adults that have a problem. So I would still tell that family, go ahead and wear the mask, be safe. April is coming right around the corner. By May 1st, we'll be really out of the woods, and it'll be a lot easier by then.
You're absolutely right. Sometimes I'll just catch my daughter. She's still off the bus and still wearing her mask. And I said, you can take your mask off now. They don't even realize. What about our littlest ones? Because obviously there's still no vaccines for children under 5 years old. They may be in childcare situations where masks become optional. Since they are not vaccinated, none of them, would you still recommend them wearing a mask in those situations where they're going to be surrounded by a lot of other children who are also unvaccinated?
Yeah, I wish we had a vaccine for that age group, and the FDA made a recommendation to at this point wait till they have the data on the booster for those kids, and hopefully we'll have that anytime soon over the next maybe 4 weeks, but not soon enough, unfortunately. So again, the same recommendation: under 2, you don't wear a mask. We haven't recommended that. Over the age of 2, 3 and above, because they're not vaccinated, they're in a daycare situation with many other kids. I would still recommend that through the month of March, keep that mask on, do as much as you can, talk to your daycare provider, and wait a little bit longer. Once we get to April with positivity rates less than 1%, with great percentage of the population vaccinated, the spring comes in, I think we're going to be a much better place. And at that point, I think we could probably remove the mask. So we're almost there. Hang in there, parents. It's been very difficult. It's been very tough 2 years without any question. You've done a great job so far, so don't lower your guard quite yet. Wait a little bit, 4 more weeks and you'll be okay.
All right, good advice. We always love having you, Dr. Salazar, here on Channel 3. We appreciate you being with us once again and sharing your expertise. Thank you so much.
Thank you, Erin. Take care.